Subacute Cutaneous Lupus Erythematosus, SCLE, is a mouthful, isn't it? Let's break it down. Lupus is a disease where your immune system, your body's defense force, gets confused. It starts attacking your own healthy tissues. Cutaneous means it affects the skin. Subacute tells us it's not as severe as some other forms of lupus. SCLE shows up as distinct rashes on your skin. These rashes are usually red and scaly. They can be sensitive to sunlight. SCLE is just one type of cutaneous lupus. There are others, and they each have their own characteristics. Understanding the different types of cutaneous lupus is important. It helps your doctor give you the right diagnosis, and that leads to the most effective treatment plan for you. We don't know the exact cause of SCLE. It's likely a combination of factors. Genetics plays a role. If lupus runs in your family, you might be more likely to develop it. Your immune system is also a key player. In SCLE, it mistakenly attacks your skin cells, causing inflammation and rashes. Then there are environmental triggers. Sunlight is a big one. Exposure to UV rays can spark those telltale SCLE rashes. Certain medications can also be triggers. These include some blood pressure medications and even common antibiotics. It's important to note that not everyone exposed to these triggers develops SCLE. It's a complex interplay of factors. More research is needed to fully understand what causes this condition. While anyone can develop SCLE, it's more common in women. In fact, women are 3 to 4 times more likely to have it than men. The typical age of onset is between 30 and 40. However, it can occur at any age. Sensitivity to sunlight is a major red flag. If you're prone to rashes and skin reactions after being in the sun, it's worth getting checked out. Having other autoimmune diseases like Sjogren's syndrome or rheumatoid arthritis can also increase your risk. Remember, these are just risk factors. Having them doesn't mean you'll definitely get SCLE. It's just important to be aware of them and talk to your doctor if you have concerns. SCLE usually shows up as distinct rashes on the skin. There are 2 main types, papulosquamous and annular. Papulosquamous lesions are small, raised, and scaly. They often appear on the upper back, chest, and arms. Annular lesions are circular with a clear center. They look like a ring or target. These rashes typically appear on areas exposed to the sun. Think face, neck, arms, and upper back. They usually don't scar but might leave behind light or dark patches of skin. Some people with SCLE also experience joint pain, fatigue, and muscle aches. If you notice any unusual rashes, especially after being in the sun, see your doctor. Early diagnosis and treatment are key to managing SCLE and preventing complications. Diagnosing SCLE can be tricky. It often mimics other skin conditions. Your doctor will start with a physical exam. They'll examine your rashes and ask about your medical history. Blood tests are crucial. They check for specific antibodies associated with lupus. A skin biopsy is often necessary. This involves taking a small sample of your skin and examining it under a microscope. It helps rule out other skin disorders and confirm the diagnosis of SCLE. The diagnostic process may seem overwhelming. Remember, your doctor is there to guide you through it. Don't hesitate to ask questions and share any concerns you may have. There's no cure for SCLE, but it can be managed effectively. Treatment focuses on controlling symptoms and preventing flares. Your doctor will tailor a plan based on the severity of your condition. Sun protection is paramount. Wear protective clothing, hats, and sunglasses. Use sunscreen with an SPF of 30 or higher, even on cloudy days. Topical corticosteroids can help reduce inflammation and itching. In more severe cases, oral medications like antimalarials or immunosuppressants may be prescribed. Living with SCLE requires a proactive approach. By working closely with your doctor, protecting your skin, and making healthy lifestyle choices, you can live a full and active life. Visit mdsearchlight.com for more info. MD Searchlight. Be your own advocate.